Good afternoon. I'm Kate Maurer from McGill University, and I will be presenting today with my colleagues Hannah Bray from Oldbury Mission and Kate Bloser from Silberman School of Social Work in New York City. We're presenting our research, Seeking a Secure Base, an exploration of relationship security across the lifespan with veterans experiencing homelessness.
Next slide, please. So when we're talking about veterans and homelessness, it's important to bear in mind how this population may be a little bit distinct. So we know that Canadian veterans experience homelessness at rates that are disproportionately higher than the general population. To illustrate this, we know that veterans account for 1.7 of the Canadian population. However, when we look at 10 Canadian studies of homeless counts, this group accounts for 4.4% of all respondents. Veterans also tend to be older than the general population, with a median age of 48 versus 39, and they're also more likely to be male than female. The average duration of homelessness for veterans is 8 years, so it's quite long, and the average time since leaving the military is 28 years, which is quite important to note because it's a large gap between when they exit the military and often when they enter homelessness. Veterans experiencing homelessness also face multiple mental health challenges, particularly post-traumatic stress disorder, substance use, depression, etc., which is important to bear in mind when we consider how creating programming for them might be a little bit more particular. Next slide, please. So thinking about programming, the Oldbury Mission, which is where I work, has adapted some of its programming for particular populations, and this has really come in our shift from moving away from emergency housing to more housing-oriented solutions, more long-term solutions. And the veterans were particularly one group that we wanted to focus on, which is why we created Les Sentinelles de la Rue in 2017. And this is to address the specific needs of homeless veterans, providing them with rapid access to housing, psychosocial support, access to veteran adaptive physical and mental health services. And that last point is particularly important in that, you know, we can offer housing, we can offer support, but it's really about making it veteran specific. We also created Opération Chez Toi, which lasted a year, and that was more for individuals who were going through transitional housing and weren't necessarily ready for rapid housing. So similarly, it was transitional housing, following entry into shelters and day centers, and most importantly, it was pairing them with a counselor trained to work specifically with veterans.
So veterans attachment research shows that the bonds that develop between military peers are often quite strong. And this may be because we know that from research in the US and the United Kingdom that veterans and service members have higher incidences of adversity in childhood. So a lot of folks posit that these childhood experiences may lead service members to seek out the military as a means of escaping conditions at home or finding feelings of camaraderie and belonging. And this corrective experience may be very valid. Veterans with ongoing secure relationships report easier transitions to civilian life. What we don't know, however, is how veterans' relational attachment varies over time and how this variation in relational attachment contributes to post-discharge veteran homelessness.
So we focused on attachment theory and the secure base, which may be concepts that you're familiar with, but we thought it would be helpful to give definitions. As most of you know, in terms of the predictors of becoming homeless, there is, of course, income insecurity and then loss of relationship connections are two of the biggest predictors of, or biggest risk factors for homelessness. So in that context, we wanted to look at not whether or not the person had relationships, but what was the quality of the relationships. And thinking of this span that Hannah mentioned, from the time leaving the military to the time becoming homeless being so long, we were interested in thinking about what could change during that time that might predict a higher risk for homelessness. So we focused on attachment theory, which was developed by John Bowlby in the 1950s. And it really focused on the quality of the relational bonding process. So how we learn to have relationships with other people, which we learned in our original relationship, which is a child with their primary caregivers, and early research really focused on children and their mothers. And the idea of attachment theory is that we develop internal representations of social relationships that are based on our past experiences. And then these then influence our future experiences in how we reproduce our representations of our own self-worth and our capacity to trust others. Obviously, trust is fundamental to relationship building and to maintaining relationships. Early research posited that that children's relationships, that attachment formed in childhood was stable over time. And what we've learned is that it's, in fact, attachment is malleable over time. And so we see variations in adult attachment also. So this led us to adapt a model that was developed by Schofield and Beek to interview parents about their relationships with their young children. And the parent is seen as the secure base. And if a child has a strong attachment to their parent, then they're able to move away from the parent and engage in other relationships. And they have identified 5 domains which are extremely important to building this secure attachment base with the parent. One is a sense of agency or cooperation. 2, family membership, sense of belonging. Also, as I mentioned, trust, extremely important and based on the availability of the parent and the relationship. Parental sensitivity gives rise to capacity to regulate emotions, so respond to situations that are emotionally activating and stay regulated during that. And then an accepting parent will help generate self-esteem. So we adapted this to think about the experience of veterans. And in the place of the parent, we proposed institutions, peers, and family. And we wanted to take a look across the life cycle to see this trajectory of attachment and the variations across it. Although we didn't start at early life because we wanted to start during the experience post-military in the interviews, in terms of the life cycle, we looked at early life, transitions into the military, transitions to civilian life, then the post-military life, the transition to homelessness, the experiences during homelessness, and then the experience in our program, the Sentinelles de la Rue. And in this way, we got a picture of the trajectory of and changes in attachment across time.
So this brought us to our current research question, which was to really explore the quality of relationships and engagement in services at the intersection of military service and homelessness in these 3 key domains of relationships: families, peers, and institutions. We engaged a longitudinal perspective to explore relationships prior to exiting the military through the present Veterans Housing Program.
So practically, if we're talking methods, first of all, the study received ethics approval from McGill. Our methodology was actually quite straightforward. It involved 2 one-hour semi-structured qualitative interviews with participants adapted from the Secure Base Attachment Framework. And these were conducted in 2019 to 2020. One thing that I think is quite important to mention here was that some of the interviews were conducted before the pandemic, some of them were conducted during the pandemic. So some of the interviews were done in person, while others were done over the phone. Participants were given cash compensation for each interview after each interview, and interviews were recorded with one exception with consent and transcribed verbatim in English and French, with French being the original language for all of the interviews. Finally, the data was coded thematically and in vivo, with each one of us who are speaking here today bringing our own expertise to the code book and then merging it together at the end. The next slide, please. When we talk about our study participants, we had all male participants. There were 9 of them, 8 from Sentinelles de la Rue and 1 from Opération Chez Toi. We had, in terms of ethnicity, 6 white or French Canadian individuals, and then 3 other ethnicities. There were 7 Canadian Armed Force veterans, as well as 2 with military service from outside Canada. All of our participants had entered military service throughout the 80s, and reflecting that they were aged between 45 to 64.
So the results of our studies, as you see, we're going to, as Hannah mentioned, our interviews were first in French. So we're presenting both the French and the English versions of our quotes. And as we spoke about that many veterans have early complex family situations, and our participants reported this. This quote is from a participant who was in foster care, and the parents of the household perceived that the kids that they were taking care of lacked autonomy, and decided that being in the Army would be good for all of the kids. And so this is how this gentleman ended up in military service.
So as you can see here, participant 630 stated, most veterans have such pain from the military that they don't want to talk about it anymore. And we saw this sentiment shared by other participants about challenging military experiences. Some wanted to avoid memories from the military and in some ways their own military identity. Participants also discussed experiences with violence during the military that included combat and torture. Participants also shared instances where instead of a corrective experience with peers, they had a particularly negative experience. And this was especially reflected with leadership, with military leadership, where they experienced further victimization. So while military identity was really tied to this idea of being a brother in arms, it also contributed to well-being in many ways, but other components of this veteran identity prevented veterans from seeking help related to psychosocial stressors, including housing. Military identity contributed to help seeking in two ways. One here was this idea that a soldier never asks for help. So in this way, stoicism barred veterans from engaging support systems to prevent homelessness. Second, veterans really thought they were others who were more worthy of support than themselves. And that it's very interesting to note too, that after the first interview, we had to change the language of the interview guide. The interview guide initially asked about asking for help explicitly. And veterans reported that, again, they didn't seek help. They didn't seek help from anyone. So we then had to ask, who do you go to, which solicited more robust responses from the participants.
So many of the participants reported what we know to be important in homelessness experiences in general, which is ruptures in relationships leading to a loss of stable housing. In this particular gentleman's experience, he was in a relationship and was renting a condo with a partner, and the relationship became untenable. And rather than continue in what he perceived as a threatening situation, he walked away from his condo and left it with his partner. And that was his entry into homelessness.
So another result that came forward is this idea of challenging transition experiences. And by this, we generally mean challenging transition experiences out of military service. This got tied up a lot with participants' sense of vocation and identity, with how they had gained all of this professional experience and all of these like applicable skills while they were in their military service. And beyond just not necessarily totally embarking in civilian life after they exited the military, there was a sense that they weren't recognized. And that's echoed in this quote here, where if you look at the last line, 488 says, "I was a medical assistant and they didn't even recognize me as an orderly."
So relational attachments with other veterans were extremely important. Again, this was described by two different participants as being brothers in arms. And veteran participants were drawn to the programs because of their veteran identity, and some saw it as a means of helping other veterans in addition to feeling understood.
Another result that came forward, and speaking to this idea of relational attachment, was certainly related to staff support. So I mentioned this earlier, that a huge part of designing the programming for this group was ensuring that there were veteran-specific supports. And this goes beyond really adapting things from a psychosocial point of view, but ensuring that staff are really well equipped to work with people with military experience. So as participant 842 indicates here, he talks about how his caseworker took him and another veteran out to see the Super Bowl in a restaurant. And that to him was extremely meaningful because it spoke to his sensibilities as somebody with military experience where he could connect with other veterans.
So in terms of our key findings, we wanted to highlight that as somewhat as expected, given this gap between the exit from military service to becoming homeless, difficulties in the transition to civilian life were experienced by some, but not all. Most became homeless after a gradual loss of support and a perceptible deterioration in the strength of their attachment bonds with their intimate others. So across those three domains of family, peers, and institutions. And for many, the experiences they had in childhood, as well as in the military, led them to focus on helping others, either professionally or in a personal capacity when they re-entered into civilian life. And many reported challenging or breached relationships with military and veterans institutions, which is known as institutional betrayal, and there's a large literature on that. And also is related to the becoming homeless in the sense that if you don't access these services through veterans institutions, you're not accessing funding that could in fact help mitigate instability in housing. So in terms of the significance and implications of this study, our results definitely echoed the research that shows that attachment varies over time and is extremely context dependent. The transitions in the life cycle are certainly important, but what we really saw was that the further out from the military experience, for example, the more relationship bonds weakened, such that people who did not maintain their engagement with institutions, and that even those who did experience challenges in the transition to civilian life, those challenges didn't affect relational security right away. The effects sometimes took years to manifest. So what we see is that successful transitions out of active service and out of homelessness for those veterans who experience homelessness really depend on a long-term perspective, looking at building and maintaining secure relational bonding, i.e. attachment, over time.
So just to wrap us up with some implications and future directions, we understand well that relational security, both with staff and other veterans, is essential to helping veterans engage in services and to prevent homelessness or remain rehoused. So once again, we're underlining here that the need to adapt services for the very specific needs of veterans is absolutely the golden standard for what we're working with here. In addition to this, we have to underline that we need early intervention and support and outreach, along with including relationship strengthening support programming for at-risk veterans. If we had better early intervention and outreach, where individuals didn't even have to find themselves at the doors of a place like OBM, we wouldn't even be having these conversations, or our conversations would be very different. Future research on veteran homelessness should further investigate the trajectory of attachment security across the lifespan. So we need to think beyond just the military service and what happens when somebody becomes homeless. We need to think about things across lifespan. Finally, policy and research should seek to understand the complexity of veteran social networks and focus on integrating these strategies to prevent veteran homelessness. So certainly the brotherhood is very important. And that's all. Thank you.